Hi everybody, that's my Dr. Nick impression. My name is Jonathan. I am a nurse. I'm a nurse practitioner student. This is my first video, and I hope to have many more of these videos in the future because I want to discuss and talk about stuff that will make me a better nurse practitioner, but also make you, the viewer, a better and more informed patient. Because there needs to be a consensus, there needs to be a partnership between the nurse practitioner and the doctor and the patient to find out what's best, because we each have our own specialties, we each have our own abilities. The patient knows their body the best, and the nurse practitioner and the doctor are supposed to be experts in medicine. And so of course, according to Hippocrates, the first rule of medicine is to do no harm. So that's a good place to start. So what I'm going to talk about today is tinnitus. It was brought to my attention that someone named Chris Ellis was suffering from tinnitus, or still is suffering from tinnitus. It's difficult. I researched 3 papers that I'm going to discuss. Since I'm a student, I have access to some research, and so I have 3 papers that I want to discuss concerning tinnitus, but it is not an easy thing. The medical model has no real definition or consensus on how to treat tinnitus, so I thought I would start with some of the basic ideas behind it. So, here we go. This is a beautiful little picture. It talks about the ear. Alright? So I'm going to go old school today. Old school with the pictures. The 8th cranial nerve is actually the auditory nerve, but it's made up of the vestibular nerve and the cochlear nerve. So a lot of people have experienced acute tinnitus if they have shot a gun or gone to a rock concert, or had that ringing in their ear, that low hum or the high pitched hum from experiencing loud music. Well, tinnitus, chronic tinnitus, occurs all the time. So I'm going to quickly go through these studies. The first one is from the Annals of Audiology, Rhinology, and Laryngology, and it talks about a simple classification because apparently in 2015 is when this was written. They didn't have a good definition or a good consensus of what tinnitus, of the actual definition of tinnitus. So what they did is, based on 10 years of experience, they came up with a definition of different aspects of tinnitus. So the first definition is auditory tinnitus. This has specific pathogenic events, such as noise-induced trauma, which I talked about, ototoxic drugs, Meniere's disease, chronic middle ear disease. So that's actually happening to the auditory nerve, or to the actual ear itself, the components of the ear. The second is somatosensory. This is more of the body, so it could be the cervical neck, the vertebrae, the TMJ, which is a jaw issue, but it's outside of the ear and more within the body or the neck or the jaw. So that was number 2. Number 3 is psychopathology. I had a question about this one because tinnitus is unbelievably annoying. So does the tinnitus cause the psychopathology, or does the psychopathology cause the tinnitus? I wasn't really sure after reading this video. But it can include things such as anxiety, sleep disorders, cognitive, substance abuse, and different things like that. And then number 4 was a combined of the first 3. So they provided a nice little algorithm here, kind of like an if-then chart, so if you have auditory tinnitus and specific tests to determine whether you have auditory tinnitus, then you go further. They didn't really give any ways to treat tinnitus. They just basically said these are the definitions. These are a more concrete and better definition of what tinnitus is. They did say that better diagnoses lead to better treatment, and that if you find something that works, that stick with it. And that's number one. Number two is more of a review article. It comes from the Evidence-Based Complementary and Alternative Medicine Journal, and this they do some systemic reviews. They looked at some different previous studies and kind of compiled. They say that tinnitus affects 10 to 15% of adults, and so it's a fairly common issue. But even as common as it is, we still don't have a good grasp on how to treat it. So conventional therapies include sound-based therapy. Sound-based therapy includes finding counseling in stress management, looking for triggers. Is trigger stress-related? Is it food-related? Then it talks about using sound enrichment, possible soothing sounds, such as an ocean-like sound or a slow-tempo music or a fan, that white noise. Background sounds, such as a television, kind of in the background to kind of counterbalance the tinnitus. And then interesting sounds. A lot of times, if you are focused on something, your body automatically ignores certain things. And so the idea is that if you are using interesting sounds, if you're using music, if you're actively watching television, then you can possibly and hopefully ignore the tinnitus. So they talked about possible cognitive behavioral therapies back in... They talked about activity planning, relaxation exercises. They talked about different systematic reviews that said how lifestyle changes can hopefully affect tinnitus, but that requires a professional cognitive behavioral therapist. A lot of VAs, the Veterans Association, are using that. Mindful meditation, they go over mindful meditation. They talk about how if you quiet your brain, quiet your environment, that hopefully you can overpower the tinnitus, because apparently they've had different random control trials that have been effective in this sense. And finally, they talk about acupuncture. I want to go into a little bit more of the acupuncture in my next study that I looked at. But they said that traditional Chinese medicine is a good place to start with acupuncture, and they gave 4 different tinnitus points. The SI19, the SJ17, the KID3, and the SP6. And then they talked about synergistic combinations. Once again, they combined different combinations together. And so that they didn't have a strong conclusion other than, the ENT doctors, the primary care physicians, the audiologists, all can be used in conjunction. So it's more of a team approach rather than a one specific treatment or one specific modality. And then finally, I found one that's talking specifically about acupuncture. Back in 2012, Journal of Alternative and Complementary Medicine took 33 patients. They received 10 sessions of acupuncture twice a week for 5 weeks. And it demonstrated in this study that the long-term effect of acupuncture was real. It actually did reduce the tinnitus. It actually did help the patients with their tinnitus problem. And so it was interesting to go through and talked about it. They actually compared what they called sham acupuncture to real acupuncture. That was a little bit confusing. But either way, both the sham and the real acupuncture were effective. And so the bottom line of this was that many attempts have been found to have alternative therapies because, once again, Western medicine doesn't have a strong grasp on how to treat tinnitus. And so they suggested acupuncture was one of those solutions, and they actually found that it was effective. They found that it was a positive thing, that people got relief from tinnitus, which is fantastic. I'm going to try to make these short in the future. I'm going to try to come up with different topics. The reason why I chose this one was because hopefully it will give some relief, and it'll give some information to the guy that I follow. I listen to and enjoy what Chris Ellis talks about. I remember that he talked about one thing about time, which was just amazing. Everybody has 24 hours in the day, so what do you do with those hours? My 24 hours are no different than the president's 24 hours, or no different than anybody else's. So my objective in this is to put something out that's positive, put something out that hopefully will help me become a better nurse practitioner, and hopefully help the watcher and the listener to have some good information, and some information that hopefully will be helpful. And so I want to put good out there instead of just being a consumer. I want to be a producer. And so hopefully this is the good start of something that I will continue and continue to produce videos. And I really want to do this, and I'm going to do this. So this is something that is important to me. If you follow Bitcoin at all, hey, I'm a student. Throw some donations my direction. I will be glad to take them, and I will be glad to provide hopefully some good and positive information along with those donations. So thank you for listening, and bye.